Okay, good morning. Glad to be here today. As was said, I'm Scott Lockard. I'm Public Health Director in Winchester, President of the Kentucky Health Departments Association, representing health departments all across the Commonwealth of Kentucky. We have 61 health departments serving all 120 counties in Kentucky. When I was first given the invitation to speak here, I had to think about it because I pictured a room full of nerds, as Ryan said, who fantasized about doing regression analysis. And I thought, I may not be your guy. You know, that may not be the best choice. But as I thought longer about it and how things change, we all use data. We all use data, and data is so important in all of our work. I'm a practitioner. I'm a social worker by training. And you know the old joke about social workers, right? How many social workers does it take to change a light bulb? Only one, but the light bulb has to want to change, right? We social workers, we look at things from a different perspective. In public health, a lot of us have done this emergenetics personality profile testing. And, we look at those different quadrants there, and I am very yellow conceptual. I'm the big picture kind of guy. There are some of you that are so green structural or blue analytical, you're still hung up that I'm not Glenn Mays, and that's what the agenda says, and you're not going to hear my presentation. So for those of you, I will be at the oral health table at lunch, and we can talk if you have an interest in this presentation. So we have to look at things and how they're different there, and all of us different working together. This year is a great year for me. I've been in public health now 25 years, 10 years of that as the director of the Clark County Health Department. Things have changed in how we do public health. 25 years ago, there was more resources around, and they would say, well, what do you think we ought to do about this? Oh, I don't know. That sounds good. Here, throw some money at it, and we'll see if we can make a difference. But now we're in such a resource-starved environment that we're really having to make sure our resources are doing what they need to do. We can no longer do feel-good programs. We have to have data. I presented at a conference on Monday, and the Deputy Commissioner for Public Health, Dr. White, was there, and she said in public health now we do a pre-test and post-test when we go to the bathroom. You know, it's all about the data now. And so we have to make sure, are we using evidence-based practices? Are we making a difference? I loved what our morning keynote said. Data is for learning and adaptation. Learning, what a novel idea that we're going to use the data to determine if what we're doing is making a difference, and we're going to modify what we're doing if it's not, and we're going to try something else. This year I have the opportunity to participate in the Leadership Central Kentucky program, and last week we toured Toyota and looked at the processes they use in Georgetown, Scott County for manufacturing automobiles. Every 52 seconds something is done on that automobile, and they have long adapted quality improvement, continuous quality improvement, making sure that what they're doing is working. Plan, do, study, act. And the community college system that partners with Toyota and many of our other industries, they are teaching this to their students in the technical components. But what about in the social and behavioral sciences and the health sciences? They're not teaching it there. Is it not just as important there? Should it not cross all of our curriculums? Should we not be looking at quality improvement and that plan, do, study, act, no matter what we're doing? So it's about a change in the way we're thinking. And for those of us in public health, we have really had to change this. When we look at research and data, I've had the privilege of teaching research to master's level social work students at the University of Kentucky in their College of Social Work. And that is challenging because most social workers, we don't like data. We don't want to do research. But when you start saying, do you want to know that what you're doing is making a difference with your clients? Well, sure. Do you want to see what's the most effective intervention? Well, sure. Well, we have to make sure that data is really the right, that we're asking the right questions, that people see the value in what we're doing with data. I had a MD friend who was an OB, and he said, making sure that your individuals know what you're trying to get at the question you ask is very important. He's doing a family planning clinic for us at our health department, and he asked this young lady if she was sexually active, and she said, no, I just lay there while he does it. So Good answer, but not exactly what he was looking for there, okay? So we have to make sure that we're asking the right questions so we're getting the data that we need. And we have to make sure that people are educated so they're good consumers of data. In the Kentucky IOM, the Institute of Medicine report that came out in 2007, Clark County, in Kentucky, we were rated as the 10th best county for health in the state of Kentucky. Okay, public health director, new public health director. Pretty proud about that. Well, then we changed our methodology and we went to the county health rankings out of Minnesota, and now I'm in the 70s. Fire the public health director, right? It's about a change of methodology, a change in the way we do things. And so having to understand that and explain that to my Board of Health and my county judge and my mayor about, okay, well, this is why our ranking has went down a little bit. We're looking at the social determinants of health. We're looking at all these other things. We're looking at things very differently now. So an understanding of that, making sure that your audience knows what you're looking at. One of the most impressive uses of data I feel like that has occurred in Clark County and then in public health, I'm a little biased on this. I see Deputy Commissioner or Senior Deputy Commissioner here as well, but I'm very biased about our dental health program that we're doing in Clark County. So this Clark County Dental Health Initiative, it began in 2008 and it was originally a 5-year project. Population-based primary intervention. So it was a partnership between the local health department, the public school system, and our private dental community all working together. Data initiated this project. Data that was reported in the New York Times about the poor rate of oral health in the state of Kentucky. One gentleman read this article and talked to his a family member, his father, when he come home for Christmas one year saying, "This is horrible, Dad. You work on this foundation here in Clark County. Why can't you all do something about this?" So that was the spark. That was the catalyst that started this whole dental health initiative. What was just reading the data in the New York Times. So this became a huge partnership in our county between the private sector, the public sector, and philanthropy to see if we could do something about the decay rate in our county. Tooth decay is the most common disease during childhood. It impacts the quality of life, illness, chronic disease, nutrition status. Kentucky, we rank 50%, 50% of the kids. Kentucky consistently ranks lowest in oral health in the nation. 50% of our kids in Clark County had tooth decay in 2008. The goals and objectives of the program. We looked at applying dental varnish twice a year in our schools and using a specific product that had what's called ACP in it, which helps to remineralize teeth. And not just, prevent decay, but to remineralize once decay has done. And data was built in this program right from the start. We conducted a decay missing field sealant survey on all 6th graders. So applying the varnish twice a year on grades 1 through 5, collecting data on the 6th graders to see, are we making a difference, okay? And that's the key thing about data. You have to plan on data being involved right from the initial project design. And then we also provided oral health education in schools and tried to link the kids with a dental home. We had a lot of dedicated service here, and thinking about where you learn about doing these things, the gentleman here in the lead here, that's Dr. Rankin Skinner, he does a lot of work in Ecuador each year. He's been going down to Ecuador for many, many years, for decades. And he was finding that they were doing this, applying this varnish to the kids' teeth in Ecuador, and he was seeing better decay rates in children in Ecuador than in Clark County and in Kentucky. So we're taking something we were doing for a third world country and let's bring it back to Kentucky and do something about it right here at home. Great, great practice that has been implemented there. What happened here? 2,500 students in grades 1 through 5 in Clark County, Kentucky. When we did the initial survey in 2008, we had 50% tooth decay. In 2013, 11.2%. Okay? We would like to say we have the lowest decay rate in the state of Kentucky for any county. But you know the truth of the matter? We don't have decay rates for every county in the state of Kentucky. We don't have the data. We need to have the data. So we can't prove that that's so. But I still say it, and I leave it up to others to disprove it. Best decay rate, state of Kentucky. Let me repeat that. We had some tremendous outcomes here. 50% to 11.2%. On the back table back here, we've got a poster that we presented at a national conference about this, and it's got other findings as well, not just on the overall decay rate, which is so important, but looking at some of these other outcomes too. We looked at the filled cavities. Well, the filled cavities in the children's mouths went up from 28% to 35.7%, which means what? More children are seeing a dentist, okay? So we were getting that dental education outcome reached. Sealants, 10.8% to 41.3%. Awesome. Prevention, that focus on prevention with the sealants. So lots of, again, positive outcomes that we saw here with this program that could be replicated other places. And guess what happened? That did happen. We had state recognition with the Kentucky Public Health Association that recognized the Clark County Dental Health Initiative as the Outstanding Group Project of the Year. So, recognizing what they did. And then Governor Beshear was able to secure an ARC grant. If you've heard of the Smiling Schools program in the state of Kentucky, that is entirely built upon what was started in Clark County. So we're very proud of that. Millions of dollars have come into the state to replicate what we did. Plan, do, check, act. It was working. So let's take it, replicate it, do it more places. Also, too, it received a national recognition. The National Association of City and County Health Officials identified this as a model practice for the nation. Again, just phenomenal outcomes that we were able to see. Benefits healthier children, fewer missed days of school, children learn better. Think about that. If you've ever had a toothache, can you pay attention to what's going on that day? Could you listen to one of us as speaking up here? No, all you focus on is what's going on there. So if 1 out of every 2 children in the classroom, just picture that. For me, a visual person, if I asked half the room, from the third seat over to stand up, 1 out of every 2 having decay is not paying attention. That impacts our educational, our testing, our workforce development. It impacts everything. We're biased, of course, in public health. We believe health is the foundation for education, which is the foundation for a successful life on out there. So, we really want to focus on the foundation, and we focus on prevention. So a great preventive service that was done. Phase 2 of the program, we have now we have a public health dental hygienist. Our dental team, was a little wary after all these years of the private dentists donating their time. So one of the things that happened in Kentucky, how data can be used to impact policy, we think it was no small coincidence that the State Board of Dentistry recognized prevention and formed a new class of licensure in a public health dental hygienist. And a public health dental hygienist now can do sealants, varnish application, and cleanings. Focus on prevention in the schools. And we're seeing this now in many, many counties across the Commonwealth of Kentucky that we're doing this. So ultimately, that's what it's all about. We're improving smiles every day. So thank you very much for letting me have a little bit of your time this morning. Appreciate the opportunity.